travel advisory. So today we added 9 states: Alabama, Alaska, Arizona, Kansas, Mississippi, Oklahoma, Tennessee, Texas, and Wyoming. They join the states that were already on the list: Arkansas, Louisiana, Missouri, Florida, and Nevada, as well as the Virgin Islands. As a reminder, these states are added to the travel advisory list when they are seeing surges in COVID-19 cases, specifically more than 15 cases per 100,000 population per day. And as another reminder, people who are vaccinated, the travel advisory does not apply. For people who are unvaccinated, if you are traveling from one of these states in orange, you need to either get a negative COVID-19 test or quarantine for 10 days upon return. I also wanted to get a little more detail into this and give you a sense of the fact that here in Chicago, we remain actually in quite good control for COVID, but that is not the case around the country. And to put that in some perspective, on this map here, the lightest yellow, which includes Chicago and the area around us, are parts of the country that are still averaging fewer than 10 cases per 100,000 per day. As you see those numbers go up, the number of cases grows significantly. And there are a number of counties. The darker the red, the higher number of cases. And there are some counties where we're seeing levels back over 100, even 150 cases per 100,000, literally 10 times the rate of what would put the state on the travel advisory. So I know there's a lot of concern about COVID here in Chicago. I'm glad for that concern because I want people to take this seriously and I want people to get vaccinated if you haven't already. But this is the Delta variant spreading across the U.S. It is now making up more than 80% of the cases here in the Midwest region and really across the country. I also just wanted to highlight that very clearly cases are tracking along with vaccination rates. If you look at this graph here, this is just over the last couple of months. What you see, that black dotted line is showing Louisiana, for example, the state that currently has one of the highest cases per 100,000. But then in blue are states in the south, and then in pink in the west, in green in the Midwest, and in red in the west. And the reason that we are seeing differing rates of those increases is because we are seeing differing rates of vaccination. So the West and the Midwest, different rates than in other settings. All right, let's look at our situation here in Chicago. So here in Chicago, as a reminder, this is the same risk matrix that we have been using throughout COVID, even before there was a vaccine available. And all of the metrics that we're following are currently in the lower risk tier. So specifically, we're averaging 165 cases per day of COVID-19. That is increasing. I expect that we will cross the 200 mark and move into moderate risk probably within the next few days. Our test positivity is at 2.6%. That is also increasing. It's still in the lower risk category, and if we get over 5%, that's when we would move into moderate risk. Our number of hospitalizations is just at the very low end of our lower risk category. You can see we're currently averaging about 101 non-ICU beds a day, and then we're averaging about 32 ICU beds a day. So overall, we do remain at lower risk, but we are moving in the wrong direction, and that's part of why we've been sharing the news with you more frequently as we've been seeing increases. If we look at a couple of graphs quickly, just to put this in some perspective, going back over the last 6 months, our percent positivity, for example, 2.6% is really quite good. And if you think about where we were for months, we would have killed to be at a 2.6% positivity. But compared to where we were just a few weeks ago, we'd gotten as low as 0.4%. And similarly, that 200 cases per day, we've really enjoyed these last 2 months being under 200 cases a day. But for some context, all of last year, from the beginning of COVID all the way through, there were only 13 days in the whole year in early June that we were under that 200 case per day mark. So I want people to be concerned, but I don't want there to be unnecessary panic at this point. I just want to make sure people get vaccinated is the most important thing. Here is data showing the risk of cases, hospitalizations, and deaths in Chicago for people who are vaccinated versus unvaccinated. So in red here, this is for cases. Going back to March, the red line shows Chicagoans who are unvaccinated who were diagnosed with COVID. The dotted blue line shows people who had gotten a first dose but were not fully vaccinated against COVID. And the dark blue line shows people who were fully vaccinated against COVID. So we can see going back to March, including that smaller surge that we had in April, all of the numbers went up a little bit. But the huge majority were in red there in the cases of people who are unvaccinated. And that's really been the pattern that we've seen across the US and that we continue to expect to see moving forward. If we look at hospitalizations over that same time period, similarly, in red, this is giving you hospitalizations of unvaccinated Chicagoans. And then in that same time period, the dotted line partially vaccinated and the dark blue line fully vaccinated. And you can see the risk of hospitalizations in the blue there for fully vaccinated Chicagoans is almost to zero. And it's been really great to see how protective the vaccine has been. And then finally with deaths, again, this is just the last 3 months, so not during or going back to March. And again, the highest rates by far in people who are unvaccinated. You see that dotted line of people who are partially vaccinated, and then really very low, near zero, the rate among people who are fully vaccinated. And just to put a more specific number on this, 97% of our hospitalizations and 97% of our COVID deaths going back to January have been in people who are not fully vaccinated. Let me say that again. 97% of the hospitalizations and the deaths here in Chicago in people who are not vaccinated. And if we look at the specific numbers, there have been 788 when we last ran these numbers. People who died from COVID-19 here in Chicago residents just since January. And among those 788 deaths, 767 of them were unvaccinated. And of the few who were vaccinated, the median age there was 79. Everybody had underlying conditions. So there's no such thing as a 100% protective vaccine, but these vaccines continue to prove their safety and their efficacy in the real world. Today marks 1 year since the first phase 3 trials started for the COVID vaccine. They mark the beginning of vaccination for us here in the US. And I hope people who have been waiting and seeing, which I've heard a lot, now feel confident where we literally have billions of people who have been vaccinated and a whole year since we've started vaccinating folks here in the US. Now is the time to get that vaccine. You want to be a blue line on these graphs. You want your risk of cases, hospitalizations, and deaths to be low. 2/3 of eligible Chicagoans have gotten at least that first dose of vaccine. That's 67% if we look at everybody over the age of 12. It goes up to about 69% if we look at those over 18, about 73% of those over 65, and about 60% of Chicagoans who are eligible are fully vaccinated. The vaccination rate in Chicago has actually stabilized over the past few weeks. Again, you see these numbers are much lower than they were back in April. But I want to point out here that the majority of people getting vaccinated are getting vaccinated in pharmacies. That's that pink line, the pink numbers there. And then after pharmacies, we're seeing people getting vaccinated predominantly in their outpatient settings, meaning with their doctor, whether that's a federally qualified health center or an outpatient doctor. And then there are more getting vaccinated in the hospital setting and through public health. But as a reminder, you can walk into pharmacies, nearly every pharmacy here across Chicago. You're not needing an appointment. They make it easy. And I want to remind people, getting vaccinated is the most important thing. You will get the same card. We got this question, regardless of where you get vaccinated. But please make that decision to get vaccinated today. We continue to focus on vaccinating both adolescents and seniors. We're making the most progress each week in that 12 to 17-year-old group, which is good because that's the group, particularly as we're looking toward heading back to school, that we'd like to have as protected as possible. But you can see we still have a ways to go for both our younger Chicagoans and those over 80. And we're continuing to focus on vaccinating Black Latinx and Black non-Latinx and Latinx Chicagoans. You can see about 41% of Black Chicagoans have gotten at least a first dose of vaccine, and about 49% of Latinx, compared to more like 62 to 65% of white and Asian Chicagoans. And we know that COVID has hit harder in the Black and Latinx communities, so particularly there, would encourage folks to please take advantage of the safe, effective, free, and available vaccine. Finally, I want to talk about Lala because I know people have questions. So where we're thinking about attending Lollapalooza and how to attend safely, I want to remind people to enter, you must bring a printed copy of your vaccine card, vaccine record, or a negative COVID test taken within 72 hours of the day that you're coming into Lala. You need to activate your festival wristband and register for cashless. And then if you're unvaccinated, we're recommending you wear a mask throughout your time on site. Also, just as a reminder, only clear bags are allowed, and there are no liquids allowed to be brought into Lollapalooza. Remember to wash your hands or use a hand sanitizer, limit consumption of substances, especially if you're not sure what they are, and consuming alcohol that can make you less likely to follow COVID measures and generally can be an issue that we've seen associated with Lala in the past. And don't attend Lala, really. Don't attend. If you develop any symptoms of COVID-19 and you haven't taken a test, even if you're fully vaccinated, and if you've tested positive for COVID in the last 14 days, do not attend. The last thing is to make an announcement that we are expanding our capacity for Chicago at Home, Protect Chicago at Home. For those who are not aware, this is the program that we started with for people who were homebound, and then we expanded it to people who were over 65. And then we were really, I believe, the only large city that has expanded this to anybody in Chicago over the age of 12 who would like to schedule a vaccine appointment at home. We will make an appointment for you free of charge. You can call 312-746-4835. So we're doubling capacity because we've seen very good uptake, especially among both older folks and young and adolescents with their families, which is a primary area. We've also seen a majority of vaccines going to Black Chicagoans, which is a group that we've been working hard to reach. So appointments can be booked now, chicago.gov/at-home. You can do either Pfizer or Johnson & Johnson. We can vaccinate up to 10 people at a time, and we're expanding the hours as well so that there are now hours available till 6:30 p.m. On the Monday through Friday to better meet needs of working folks. And then the last thing is Grubhub had sponsored the initial expansion phase of this to everybody, and we'd been giving folks who were getting vaccinated a Grubhub gift certificate, one for the group. As we are coming to an end and expanding that, we are now providing $25 Visa gift cards. One of the reasons we're doing that is we heard that people who didn't have a phone maybe couldn't access the Grubhub app. This is literally just a card that you can use anywhere that Visa would be accepted. Again, we'll be giving one of these to anybody who is vaccinated in this group. So if you get 5 people together, each of those people will get a gift card. But we encourage you, just as we did last time, use that opportunity to celebrate vaccination, and it's to also encourage people to spread the word. We continue hyperlocal vaccination events. We've been doing really well at a number of our outside events like Swaparama and Brickyard Mall in the Northwest and Southwest continue to be very successful events for us. And so we're out there every weekend. And I just wanted to give you a flavor of last weekend alone. We were at a community health fair with the Allergy and Asthma Network. We were at the Chicago Humanities Festival. We were at vaccine pop-ups in Greater Auburn Gresham, as well as Little Village. We were at the Mason Park Block Club. We were at a Fatherhood Initiative summer celebration. We were at a church. We were at a laundromat. We were at another church and a jazz coalition. And we've really been working to try to make sure where we are putting our efforts, they're places where people are excited to get vaccinated and where we're seeing good numbers. And then in a lot of the larger, more fun events where we don't always find people saying, I want to get vaccinated on the spot, we're doing more of the vaccine ambassador work and helping people sign up for at home. So for example, at Lollapalooza, we're not that interested in vaccinating on the spot. We need people to already be vaccinated by the time they come in. But where people are coming with testing, our vaccine ambassadors will be on site, encouraging those people to sign up for at home. Appointments remain available, ZocDoc.com/vaccine or through that same phone number. And I just want to remind everybody that We certainly are concerned as numbers are increasing around the country. I expect to continue to see increases here. While it's summertime and we can gather out of doors, that remains the safer way to do so. And where people are feeling uncomfortable, we certainly encourage mask wearing, but we're not at a point where we're needing to recommend that for the whole population because we remain at lower risk and we've been seeing those vaccines be highly protective. With that, I'll have Dr. Luna give some comments and come back for questions. Thank you.
Sí, muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les traemos varias noticias. Primero que nada, queremos ir a las restricciones de viajero. Si piensa viajar, el Departamento de Salud Pública acaba de agregar 9 estados al aviso de viaje semanal porque los casos de COVID-19 continúan aumentando. Lo repito, aquí en los Estados Unidos, en los 50 estados. Alabama, Alaska, Arizona, Kansas, Mississippi, Oklahoma, Tennessee, Texas y Wyoming. Y ahora hay 14 estados y un territorio en aviso del viaje, de restricción de viajero en la ciudad. Todos estos estados han superado la marca de 15 casos por día de cada 100,000 habitantes. Estados y territorios en avisos como Arkansas, Luisiana, Missouri, Florida, Alabama, Islas Vírgenes, Oklahoma, Nevada, Mississippi, Alaska, Arizona, Texas, Kansas, Tennessee y Wyoming. Se recomienda a todas las personas no vacunadas que viajen a estos estados y territorios que obtengan un resultado negativo de la prueba de COVID-19 no más de 72 horas antes de entrar a Chicago o se pongan en cuarentena durante un periodo de 10 días después de su llegada. Las personas vacunadas no necesitan ponerse en cuarentena ni recibir una prueba de COVID negativa. Todos los viajeros aún deben seguir con las reglas federales de enmascaramiento, distanciamiento social, el lavarse las manos a menudo cuando estén viajando. Se requieren máscaras en aviones, autobuses, trenes y otros transportes públicos que viajan hacia dentro o fuera de los Estados Unidos y en los centros de transporte de los Estados Unidos como aeropuertos y estaciones. Los números de COVID siguen subiendo, pero todavía nos encontramos en el riesgo bajo, escalando cada vez más y más. Tenemos 165 casos de COVID positivo el día de hoy, que son 3 veces más de lo que teníamos semanas anteriores. Igual hemos doblado el número de la seropositividad del virus aquí en Chicago. Ahora estamos en 2.6 cuando hace 3 semanas atrás estábamos en 0.4%. Las hospitalizaciones han aumentado y los casos de intensivo también han aumentado. Recordemos que 97%, y quiero hacer la salvedad y quiero recalcar este número, 97% de los casos registrados de COVID positivo aquí en Chicago son en esos casos de personas no vacunadas. Y el otro % que estaban parcialmente vacunados o vacunados son personas que tenían condiciones subyacentes que los ponían a alto riesgo. Así que el mensaje es muy claro. Esto es una pandemia de los no vacunados. Por favor, vacúnense y protéjanse. Ya se cumplió 1 año desde los primeros ensayos clínicos para los de Pfizer, que ya cumplieron 1 año. Esas personas que estaban esperando más de 1 año, un tiempo razonable, para recibir su vacuna, este es el tiempo. Por favor, no lo dilaten más para recibir su protección y proteger a las personas a las que aman. Nuestros niños de 12 a 17 años están escalando, los números de vacunados están subiendo, pero aún en las comunidades latinas y afroamericanas vemos esas disparidades, números bajos y comunidades completas muy expuestas al COVID-19 por su bajo porcentaje de vacunación. Ahora, en una nota muy positiva, estamos expandiendo los servicios al domicilio, de vacunación a domicilio. Hoy anunciamos una expansión del programa de vacunación en el hogar del Departamento de Salud Pública de Chicago, Protect Chicago Plus at Home o Protege a Chicago en su casa, con tarjetas de regalos de Visa de $25 que se ofrecen a todas las personas que reciban la vacunación en su hogar. Todas las personas mayores de 12 años son elegibles para recibir la vacuna y la tarjeta de regalo. Las citas se pueden reservar ahora y la distribución de las tarjetas de regalo comenzará desde el 2 de agosto. Si necesita una cita, por favor, el número de teléfono y tomen nota es el 312-746-4835. Repetimos, 312-746-4835. Desde sus inicios, Protect Chicago at Home, o Protege Chicago en su hogar, ha estado operando casi a plena capacidad y la ciudad ha agregado proveedores adicionales para ampliar las citas. Ahora, para satisfacer las grandes demandas actuales y vacunar a más habitantes, la ciudad está duplicando la capacidad a 900 citas por semana y extendiendo las horas de operación los días de la semana de lunes a viernes de 8 a 6:30 de la tarde. La capacidad adicional debería disminuir los tiempos de espera para las citas en el hogar que actualmente están completando y se reservan con 2 semanas de anticipación. O sea que si pone la cita ahorita, serían 2 semanas después, pero con esta nueva capacidad y expansión, esperamos que las citas se puedan dar mucho antes de ese periodo. La vacunación en el hogar ofrece la posibilidad de elegir entre las vacunas Pfizer para todas personas de 12 años en adelante y Johnson & Johnson para personas que parten de 18 años en adelante. Se pueden vacunar hasta 10 personas en el hogar, por lo que los habitantes de Chicago pueden invitar familiares, amigos, vecinos a su casa para que se vacunen juntos en un ambiente celebratorio. Las citas están disponibles de lunes a viernes, como ya les dije, de 8 a 6:30 de la tarde. Hasta la fecha, la ciudad ha administrado vacunas a más de 5.800 habitantes en Chicago en sus hogares, lanzando inicialmente en marzo para las vacunas de las personas mayores confinadas y ahora para las personas que tienen discapacidad y ahora toda persona mayor de 12 años en adelante califica. Cualquiera que sea tu necesidad, puedes llamar y puedes recibir tu vacuna en el hogar, aunque no tengas una necesidad imperante. Igual, si te sientes cómodo recibiendo tu vacuna en el hogar, por favor llámenos, hagan cita y reciban esa vacuna. Es el único programa de vacunación domiciliaria a pedido que está disponible a todos los residentes de 12 años en adelante en los Estados Unidos y eso es un gran motivo de celebración. Para programar una cita, acuérdense, es el 312-746-4835 o pueden visitar la página web chicago.gov/@home. Gracias.
Thank you, Dr. Lina. Happy to take questions.
Thank you, Dr. Arwady. When Lala was first announced, it was going to be, you had to show your vaccination card or a test 24 hours. Now it's 72 hours. Why the change?
Sure. So when we initially made that announcement, months ago at this point, before reopening, we had made a decision and announced that we wanted to have testing or vaccination available. And we did say the 24 hours at the beginning there. However, when we started actually looking into operationalizing this, what we see is all over the country, 72 hours is the more typical standard. And that's primarily because if people are getting a PCR test, it actually takes more than 24 hours for that result to return. And so where you look at, in New York, where they've required testing to get into indoor spaces, if you look even here at our Smoke Fest, if you look at any of these, 72 hours really is the standard. And so we made that decision after we had gone ahead with reopening and all of the written guidance really since then. So it was really about us looking to see what was practical and then also what is in line with standard practices.
There's, of course, been some debate among other prominent doctors who think that perhaps Lala should have been canceled. As an epidemiologist, are you confident it will not turn into a super spreader?
So what I can say is that first, I really want to emphasize that we have done everything, and I really want to thank the folks who put on Lollapalooza for taking this extremely seriously. If you think back months ago, it was not a small thing to say we're going to require vaccination and testing or testing. There was a lot of debate about that, and they've really gone beyond that too. Everything from they've looked at their air handling for any of their indoor spaces and improved that. They're doing all the things with making masks available and making sure that all of their backstage workers are vaccinated and ensuring that the ticket takers are tested, and have really gone, I think, above and beyond. And particularly where you compare this to a lot of other festivals around the country. I mean, if you look at Summerfest, for example, which is the largest music festival scheduled in Milwaukee, no COVID protocols in place of any kind. I would not feel comfortable moving ahead with Lollapalooza without COVID protocols in place. I don't think I would feel comfortable if this were an indoor event either. And I frankly don't think I would feel comfortable if we were sitting in Louisiana right now, where cases are looking like they're looking. But where we are right now, we're taking COVID seriously. And I can't promise that there won't be any COVID cases associated with Lolla. When you're having this many folks who are coming through, almost certainly there will be some cases. But I'm confident that the combination of what we know about limiting risk in outdoor settings, pairing that with vaccination and or testing, and ideally mostly vaccination, which is what we expect, as well as all the other mitigation factors. I'm certainly hopeful that we won't see a significant problem, and I certainly know we're being a lot more responsible than many other settings that are just as large that are gathering around the country.
So I'm trying to imagine, as people come in the past, you often see the shot of everybody running on in, but obviously they have to have their ticket checked first. If they have to show a printed copy or something of their vaccination card, or perhaps it's on their phone or the negative test, is that going to cause some kind of public safety issue? I see a line going for blocks and blocks.
Yeah.
Maybe I'm misreading how that all is going to happen.
Yeah, so again, the Lolla team has really been working on all of these logistics and thinking about having sort of some separate checkpoints for the wristband versus the vaccination records. One of the reasons we are really asking people to bring that printed record is because we expect that can speed that up. As you know from, going through an airline check, if people are trying to fumble for their phone and their digital, it can really slow things down. So having that printed available, with your identification is one way to speed that up. But they're being serious. Like, we want to check this, and we want to make sure that people have those requirements. So maybe do leave a little extra time if you're coming to see a particular band, and please have some patience. We're doing that just to help everybody keep as safe as possible. And one other piece is I would just remind people, in a lot of ways, we have less concern about the event itself, which is outside and has restrictions around it. And I have more concern if people are having parties inside and gathering. So particularly if you're unvaccinated, please make sure that you're, masking in settings that would be higher risk in indoor settings.
So when do you see us reimposing this mask mandate? Is it going to happen at the 200 plus, or is it at the 5%?
Okay, so
or both.
Yeah, so we're always looking at a number of metrics, all together, and that's why that risk matrix that we use right up at the top, where we say when we move to 200 cases, for example, that's when we move from low risk into moderate risk. When we move to 400 cases per day, that's really when we move from moderate into high risk, honestly, higher risk. And that 400 cases per day is the equivalent of our travel advisory, if that makes sense. Like, when we're at 400 cases a day in Chicago, that's 15 cases per 100,000 per day, which would put somebody on our travel advisory. So from my standpoint, if we get to a point where we're at that higher risk, it probably would make sense, just as we're recommending, other settings where the risk is higher for people to, to mask and test and potentially think about avoiding travel. So when we get over 200, we start certainly watching more closely. We may make some recommendations around people who are older or have underlying conditions. And I certainly encourage people who are concerned, I continue to wear my mask often when I'm walking into an indoor place in particular, unless I'm able to assess that everybody's unvaccinated. As soon as I'm in a setting where everybody's unvaccinated, I take it off and I'm really not concerned. But my feeling is we want to make sure, if we are moving to particularly a mandate around masking again, even for people who are unvaccinated, I want to do that based on our local data and our local risk. And I want to do it at a time where really the risk is significantly higher. At this point, luckily, it remains in that lower risk. And so I wouldn't be surprised if we get there. We may. But getting more, if you're worried about it, get talk to anybody you know about getting vaccinated, because it really is where more folks are vaccinated, the risk drops for everybody. And we've seen that so clearly regionally.
Kind of a follow-up on the question that Marianne just asked. In light of the expected announcement from the CDC in about an hour and a half regarding their mask mandate, does that have any bearing on your view of what we do here?
Yeah, so certainly, we'll see what that formal announcement is. I would expect, the CDC knows, just like all epidemiologists know, that really risk is local. And the risk in, Louisiana is not the same as the risk in Chicago right now. So, I wouldn't be surprised if they, perhaps are recommending, and we think both about populations at higher risk, right? So like I was saying, might we see something around folks who have some of these immune conditions, that might want to be more careful. I could see us potentially doing a recommendation around that if we got to a higher point. Or, might they actually recommend that, in some of these states, not dissimilar from what we were seeing on our travel order, really the risk is high enough that the recommendation would go for masking for everybody. If I were in one of these states and I were making those decisions, I would be making that recommendation for masks for everybody. And so my guess is CDC is perhaps trying to just weigh in a little bit on some of those conversations. They're trying to make sure that I would hope that the data, that we're doing this in a data-driven way and less of a politically charged way.
Dr. Arwady, but does this again set up a confusing situation for folks to navigate in terms of what the CDC is saying, what you're saying, at a time when we have tons of people coming into Chicago from out of town?
Yeah. So, we don't know what the CDC is going to say yet. So we need to wait and see exactly what the CDC says. It's possible the CDC would say, we recommend that everybody in the U.S. Vaccinate, regardless. They will say everyone in the U.S. should vaccinate. They may say everyone in the U.S. should mask, regardless of vaccination status. But I don't expect that because the risk in places that are highly vaccinated or are not surging actually remains relatively low at this point. And for me, I really want to use, if we make that particularly a mask mandate, that's going to be, number one, if we have a variant that the vaccines do not protect against, right, where there's really a high risk, no question about it, we have to, continue using those masks. But otherwise, if we're really surging to a point, and if you think about the numbers, remember, when our numbers in Chicago are low, the chance of you running into somebody with COVID is low, right? It's just that. It's sort of the numbers of chance. As the numbers of people with COVID in Chicago increase, the risk of you running into somebody with COVID and being exposed goes up. And then whether you get sick from that person, the biggest difference is whether or not you are vaccinated. So while the numbers here remain low, and our hospitalization rates, our death rate, they're very low at this point, the risk to an individual Chicagoan actually remains quite good. As that increases, the chance of potentially interacting with someone with COVID goes up. That's why in settings that have very high numbers per population, they might make some more recommendations around masking. I want to be clear that if there are recommendations around masking, it is not because the vaccines are not working. And I think that's where there's been sometimes some pushback. It just has to do with where there are a lot of people not vaccinated, there's more opportunity for that to spread. And we see that pretty clearly in our local data here. So anybody who's got a concern, wear a mask. I encourage you to, right? It only helps. I feel like it doesn't bother me particularly to wear the mask. I wear it. I'm used to wearing it. I've been wearing it for a year and a half. I tend to keep it on just because I know if it helps somebody else feel more comfortable, I'm willing to do it at this point. But it's not a recommendation that we're making at the population level right now. And we may do it if we see our risk level here in Chicago really go up significantly.
Hi. I am concerned just about the propensity, and this is actually not on my list of questions, about the situation that happened in Provincetown, Massachusetts a couple of weeks ago, though, because it does strike me as something similar to here. I mean, that's a gay vacation resort town, and that was on the 4th of July. A lot of people partying, lots of people on drugs. And I think 2/3 of the people who had gotten it, and there was a cluster of hundreds of people at this point, were already vaccinated. It was a super spreader event. It was a cluster. I mean, I'm sure you know the epidemiology of what happened there, but what's to say that something like that couldn't happen in a situation like this at this point?
Yeah.
I mean, we know that the vaccines are working, broadly speaking, but there were a ton of breakthrough infections in that situation right now. It just seems like we are working with an unknown with the Delta variant right now.
Yeah, so
here.
I would say, certainly in the province health, there actually weren't hundreds, but there were more
Excuse
than
me.
100.
Yeah.
And that this was actually sort of a nationwide investigation and follow-up because it is unusual to see that. There has not been sequencing that has come out from that has suggested a different variant that I'm aware of at this point, certainly. But we've followed up even people who are in Provincetown who live, in the Chicago area. That's something that we will historically do here. And we've thought a lot about and had conversations about, that particular network. So here in Chicago, Market Days, for example, coming up is a
God.
really popular event with gay and lesbian Chicagoans, and we're doing some proactive messaging and thinking for folks knowing that there may be people again in that network, because remember it's that network, it's the people who you are closely associated with. If that is a very highly vaccinated network, that's generally protective, but it's not 100%. And so yeah, we're certainly looking at that, but it's not something where you look at the level sort of across the U.S. And that's one reason why it's good to have this national view from CDC. We've continued, and here in Chicago too, to see these vaccines be very protective, but they're not 100%.
Okay, going back to the questions I actually had, given the likelihood of exposure at Lollapalooza, do you recommend that attendees get tested after the festival or take precautions during or afterward? This is both for vaccinated and unvaccinated attendees.
Yeah, so again, I don't, in an outdoor festival, if someone is concerned, and particularly I would also encourage, masks can help, and perhaps not going to the mosh pit, right? If you're thinking about having, being at this festival, I also am pretty confident that people are able, if they have, are more concerned, to not only be outside by definition, but to also do some more distancing, right? To stay back from the very front of the stage. Where somebody is fully vaccinated, I'm not recommending testing after this event. And for people who are even not vaccinated, I'm not recommending universal testing. I would ask for anybody who attends Lolla, but also for anybody in Chicago, that if you are getting symptoms of what could be COVID, we really want you to get a test, right? They're widely available. I ordered one on DoorDash the other day to see if I could do it. Because we want, whether you're vaccinated or not, if you're having symptoms, please, get the test. And you can do a home one easily, and have and feel comfortable about that. If we see concerns related to Lollapalooza, we'll do some additional follow-up, but there's not a recommendation at this point for universal testing.
What steps, given the spread of Delta, should public-facing vaccinated Chicago workers, clerks, restaurant workers, security, rideshare, taxi drivers be taking right now, particularly those who are at risk, immunocompromised or older, or those living with at-risk people, be taking right now?
Yeah. So the most important thing is that word vaccinated in there. And there are still a lot of folks in that group who are not yet vaccinated. And, number one, get vaccinated yourself, but also anybody in your workplace, right? Hopefully someone who's vaccinated, we typically see people in their home setting, which is the highest risk for transmission, everybody who's eligible there getting vaccinated. But I would also really encourage, employees to be talking with their employers. And if you've got a fully vaccinated home setting and a fully vaccinated work setting, your risk is really very, very low. I think in terms of, masking and distancing and some of that, there are different decisions that different settings and employers are making. And I've not seen anywhere, thank goodness, that has said you may not wear a mask, right? And so, in the city of Chicago buildings, for example, like at CDPH, we've continued to have people wear masks in the public spaces, and then take them off if they're in meeting rooms, et cetera, where everybody is fully vaccinated. But different folks will be making some of those different decisions. For drivers, it's still a requirement. That's a federal requirement that everybody must mask on all forms of public transportation. That includes the L, that includes Uber and Lyft, that includes airplanes, that includes buses, that includes trains.
Returning to the matter of mandates, since we spoke last, and it was just San Francisco, now it's the whole state of California. It's New York City, which I imagine is the biggest municipal workforce in the country. It's the Department of Veterans Affairs. Has Chicago reassessed whether it will eventually put in a mandate for city workers to get vaccinated at some point?
Yeah, so, certainly we're aware of what's happening around the country and, have been having some conversations about this. My biggest priority, honestly, is really seeing what a lot of our healthcare settings are doing here in Chicago. More and more are doing, and I expect more to come, where we saw, Loyola and University of Chicago and University of Illinois at Chicago, and most recently Rush say, we're going to require this, they do that for a lot of other vaccinations. So first and foremost, I'm really interested in supporting in those health settings, and even at the health department, like where we have clinics, et cetera. I've said to my staff, I fully expect, I want folks vaccinated who are in settings where it's hard to keep distance, where there are people who are sick, where there are people with underlying conditions. And I think at the larger municipal level, it's been good to see this. I think be more in the conversation, and we're going to continue monitoring and talking about it.
Are you talking to unions right now and that kind of thing?
So there's a lot of conversations going on, I think, broadly. Obviously, there's a lot of players in this, and we'd want to make sure that all the stakeholders have had a chance to kind of weigh in and think about this before we ever consider doing such a thing.
Any new news about canvassing and reaching unvaccinated people? Phone banking, anything else going on as far as those Protect Chicago efforts?
Yeah, I would say so. This expansion of the Protect Chicago Plus really is coming from the fact that we've seen that often be really one of the absolute most successful things that we've been doing, where we're booked out like for 2 weeks now, right? Like all of the appointments were full, and especially that it was hitting demographics that we're especially interested in reaching. So we've moved, as we've been closing some of our mass vaccination sites, moved those resources to expand the at-home. And then, like I mentioned, we're doing more with trying to do outreach to people who are at risk. So our call center is not just taking calls that are coming in, but we're taking where we have lists of high-risk people with Medicaid, for example, and actually calling them and saying, can we schedule you for an appointment? And working to try to identify folks who have not had the opportunity to be vaccinated. But we are really doubling down on that at home because a lot of folks are still going to pharmacies and their doctors, which is great. That's what we want them to do. But for folks for whom that is a barrier, we've found this to be very effective.
It was taken that you said, when you're in a situation where you can assess that everyone's been vaccinated, you'll take off your mask. At this point, there's more than 300 bars in San Francisco that have joined together and said, we are, unless you've had a proof of negative test within the last 3 days, or you can show vaccination, you're not getting in. I wonder if you have any comments about that. As far as I know, no one in Chicago is doing that, but they're doing it in the Bay at this point.
Yeah, so there certainly have been some, individual settings I know that we're doing some of this, particularly I think earlier on. I know this because I've had friends say I had to show my vaccination card, et cetera, but it's not something that's been widely adopted at this point. I think the conversation about quote, vaccine passports has been a conversation that has grown and shrunk and grown and shrunk. I think, while we're on the rise here, and particularly as we head into the fall and winter, I think there is more appetite than there had been to think about where businesses, for example, might be interested in doing that. Are there technological ways to support that? Are there ways to get behind doing some of that? But it's not something at this point we've seen highly operationalized. California is surging quite a bit more than Chicago is too. I think it's another watch this space in terms of how we continue to see conversations evolve.
I've already mentioned gay issues. I mean, we're going to be on market days after this weekend. Is CDPH doing anything particularly to get ready for that, given the fact that rates are increasing and will surely be increasing more 2 weeks from now than they are right now?
Yeah, so
people are coming from all over the country to Chicago.
Yeah, exactly.
In 2
So
weeks.
I mentioned it because it's an example. I think Lolla tends to get a lot of attention, but we have a lot of gatherings that bring people, and we really try to keep track of those. And in this case, particularly because of the situation in Provincetown, right, have been talking and thinking about what can we do to educate and make sure that there's information out in advance of that. But we do that for a whole variety of things, and there are lots and lots of settings, especially out of doors in the summer, where Chicagoans are gathering. Again, if folks are vaccinated, risk really is low.
Thank you.
Can I just ask one more?
Sure.
Will you yourself, Will you be attending Lala?
Oh, I don't know yet. I think, if I attended Lala, our vaccine ambassadors are going to be there. And obviously, I'm interested in seeing the work that they're doing and being part of it. Certainly, I have been pleased with the Lala capacity. If I go, it's because I love the music. It's not because I have any particular concern. I don't have any official role, though, at Lala.
Thank you, Dr. Arwani. So just going back to the national picture, we're talking about Lala. Obviously, Chicago's the host city, but what happens in Lala is not going to stay in Lala. Are there any concerns that as people go back to their respective communities where their vaccination rates may not be as high, that could have a ripple effect across the country? Obviously, we talk about Provincetown. We talk about what happened in Sturgis pre-vaccine as well. Any concerns about that?
Yeah, so, public health has actually a really quite good pre-existing infrastructure to communicate around geographic outbreaks. And I think it's an example of something we did behind the scenes that nobody knew about. But it is extremely common when there is, a case or an outbreak that there is contact tracing that is actually done across the country. And we have ways that protect people's privacy, but allow the local jurisdiction to follow up with those individuals. So again, I know people are very focused on Lala, but there are a lot of events that are bringing people around the country that don't even have the COVID requirements and mitigation factors that we have here. And we've not seen, even where there have been, especially when they're out of doors, we've broadly not seen them be sort of these huge events of concern. If we see spread, we're ready to do some follow up as we would for any other case. But I feel good about the fact that, most of these folks are vaccinated, right? Which really is the main thing for decreasing risk.
And then again, going back to that, the follow-up is going to be important, right? This is a big event. This is going to be a litmus test. Again, Provincetown, high vaccination rates, a lot of breakthrough cases. How is that follow-up going to happen from the city's point of view after Lala?
Yeah, so the same way that, every single case of COVID that gets diagnosed in Chicago, every single one, the Chicago Department of Public Health continues to investigate. We continue to follow, get the information on that case. We continue to do the contact tracing on every single case. That has not stopped. It's not going to stop. And so just as we do for any other outbreak, if we're seeing, we're asking people, where have you been? What were your exposures? If we see patterns of concern there, we treat it just as we would any other exposure. So I'm really confident in our ability to follow up with cases. And again, with this number, I expect there will be some cases probably. But where people are vaccinated, and this isn't a festival of, people in their 70s and 80s broadly, right? Where we think about sort of some of the other risk factors too.
Just one more related question.
Sure.
I had a similar question to him, but how do these additions to the travel advisory impact attendees coming from different states across the country? So if they're coming from one of these states, does that mean anything?
Yeah, as long as they're vaccinated, right, there's not an additional requirement. They would have had to get that negative test anyway, right? Because if they're not vaccinated, the recommendation is to get that test within the 72 hours of arrival. Certainly that would be a higher risk individual. And, testing, if people are not vaccinated, really testing and being really careful if folks have symptoms, like not taking chances, is the best we have. Again, it's not a no-risk setting, but this is where we are, and we'll continue to really work on messaging and doing everything we can to make it, as safe as possible within current COVID capabilities.
Good, thank you.
Thanks, everyone. All right.
Thank you.
Thank you.